on what's been going on the last 24 hours, and also to look forward into what does that pathway forward look like. So in the last 24 hours, we have been spending a lot of time talking about test kits, testing, who to test, when to test, and all of that is part of determining who is safe to go back and work. And it's all part of the plan of going back to work. Earlier today, you heard that the governor said that she will report back to us on April 30th in anticipation of reopening. And so when I think of reopening from the city's perspective, you know, the things that we're doing is today we're planning for that reopening. And as I said, it's part of the testing is part of that, but also making sure that we have enough PPE or the personal protective equipment for those businesses that will reopen. So we're very fortunate as a city to have as much test kits as we have. And I think that you know by now, but there are two kinds of tests. There's the antibody test, which is the blood test, which takes test. It's commonly referred to as the PCR test. It's the more definitive test. It is a diagnostic test. So we are in great shape at this point in time with the number of kits that we have to do the antibody testing and the PCR testing. And as we continue to collaborate with the Unified Command, we will come up with a testing regimen that will determine, you know, who do we test and when do we test them, so that you as the public will feel comfortable about re-engaging with your dentist, possibly re-engaging with your beautician or the barber and so forth. So these are the things that are going on, and part of that process is really a collaborative effort. Earlier today, Paul Wesch and Matt Anderson were on the phone with what all the hoteliers talking about, you know, what can we do to help them and what are they going to do to protect their customers. Those same conversations we were having yesterday with the restaurant owners, trying to make sure that when we're given that green light to open up, that everybody will be ready and we won't be stumbling trying to determine what is the next step. During the course of the day, every day, from the time we start work to the time we go home, there's a tremendous amount of information sharing. Earlier today, of course, that's a lot of the city department heads and talking about things that we need to do internally to make sure that we continue to deliver you services while we're facing the coronavirus. The next call we had at 9 o'clock was with the Unified Command, the leadership of the Unified Command. That was Masiria Ludgood and Bert Isho and a couple other people to talk about, you know, being in sync with what we're doing as a Unified Command. You know, that was then followed up by another phone call with more of the city employees talking about things that need to be done in different areas. But yesterday afternoon, I ended the day talking to the 10 mayors and Senator Doug Jones, and that was about, you know, what's going on in Congress and what we would like to see Congress do to help backstop the city's the loss of revenue that we've had. So I share all that with just to say that, you know, throughout the day, every day, we are getting information not just between government officials, but also through our business owners, business leaders, just the community leaders trying to determine, you know, when is the right time for us to reopen. And yesterday, as I was watching the news last night about 9 o'clock, I saw where they said, Mayor Stimpson says we're not ready to reopen yet. And as I was thinking about that, you know, what's going to happen is that be a 24-hour period where that completely changes, and we're going to say now's the time to reopen. And when we do, that's when we want to really be ready. So we continue to ask for your patience, continue to think about the things that you're going to do to reopen to make sure that we have a successful reopening. Another thing that we have the opportunity to really step up and do something correct here is that because of the coronavirus and because of the stay-at-home order, so many of our nonprofits actually just quit functioning. Thank goodness for the Salvation Army. They have stepped into the gap to fill the void created by so many of those others that went home. But I'll say this, that the Salvation Army, they need our help right now. They need your help. They are like, just think about it this way, you know, their revenue stream has been cut off also, but they have not stopped delivering services. So anything that you can do to help the Salvation Army at this time would be greatly appreciated, because they are actually serving some of the least served in our community. So I'd appreciate that. But right now what we're trying to do is get our hands around working with the Salvation Army so that they can maybe help re-engage some of the other nonprofits to use their resources or to work with them so that we can do a better job. We also have the work of the city going on. You know, in the last few days we've had a couple of storms and a lot of tree debris in the roads, and so we've had to, you know, clean up streets. But you've also heard me talking so often in the last few days about repaving streets. But also, it's an amazing amount of yard trash that you're generating while you are home. I feel like that you husbands and probably some of you wives that are trying to get out of the house have probably done more yard work in the last few weeks than you've done in a long time. Anyway, we're grateful for the opportunity to be able to assist you in that and haul your trash off, but it has caused us to get behind a little bit. Our crews are working diligently to catch up with you, you know, so that you can complete those springtime projects. As we've done in the last couple of sessions like this, George Talbot is on social media and he's reading questions that are coming in. And so I'll ask George if he has anything that he'd like to ask me at this time.
Yes, you received a question from a citizen about leveling the playing field between the big box stores and stay-home order, and what we can do to help level the playing field.
Well, for the playing field to be level between the large big box retailers and the smaller retailers, it's really has to come out of the governor's office. And I'm not trying to avoid a comment on that by saying it's her responsibility. But you know, this was the first time that we've had an order like this come out of the state regarding a virus, a pandemic like this. And I think if the governor were to redo it, she would probably consider that maybe there has been an unfair advantage given to the big boxes, and there was a way to maybe keep the smaller retail open. And maybe she'll address that real soon so that the smaller retailer can go back to work. But it's really the governor's call at this point. But I absolutely understand the case that could be made for one's open.
This one's from Tyler at Fox 10. Yesterday in your comments you indicated that you weren't ready to reopen. The governor made very similar comments today in Montgomery, yet there are still calls from many people to reopen now. What would be your message to those people?
So you're closer to reopening. Each day that goes by, we are closer to reopening. I did not have a conversation with the governor about her statement today. I heard it like everybody else did. But one of the things that I've been tracking is the rate of infection in the city of Mobile, and that is the number of positive cases divided by the number of tests that are given. And this doesn't have really anything to do with the total number of people that have been infected with the virus. This is to show what the rate of increase or the decrease is for the number of tests being given. One of the filters that was suggested by the president's phased opening was to be able to show over a 2-week period that you had a decline in the number of cases in your community. And consecutive days based on a set of numbers that I'm looking at, that we're almost there. And so if you think of, if you're trying to check off things that we qualify for reopening, we are real close to being able to check off that box of saying that our rate of infection is in a place where we could seriously consider reopening. But again, that's going to be, I will weigh in with the governor. I will share that information on behalf of the city of Mobile, and I think it will be impactful because I'm not sure if she's seeing data like that.
This is a question from a citizen who's concerned about the nursing home situation and long-term care facilities, just wanting to recognize not only the first responders who are there helping people, but the staff in these nursing homes and long-term care facilities, and just wanting to know what you're hearing there and what we can do to support them at this time.
So on yesterday's Unified Command call, at 9 o'clock yesterday, Dr. Ishow weighed in about things that the Mobile County Health Department was doing to assist our long-term care facilities. And as I've said in the past, we have given them personal protective equipment. We have given them one long-term care facility. We tested every single employee. These test kits were provided free of charge, for the antibody kit, by the city of Mobile. So, we play a support role there. I mean, really the first line of connection to the nursing home facilities and long-term care facilities is really the Department of Health in this area. But we will do everything that we can, that we have on hand, if it means sharing the personal protective equipment or sharing testing equipment, we will do that. Beyond that, it's really up to the management of the nursing home and the health department to determine, what steps they need to take.
And this one's on that note is from a utility worker who's asking about the possibility of utility workers or other essential workers getting access to test kits.
Yeah. So when we started the process of testing first responders, then the second group of individuals that it became apparent who needed to be tested were our healthcare workers. And this is from the city's perspective. If the hospital knew it was important to make sure our policemen and firemen were in the street, so we said from our priority, it's going to be our first responders, healthcare workers, then our essential personnel, which is garbage. And so now, pretty much everybody's weighing in, making their case for, they are, as an essential worker, can they be tested? And the answer is that yes, at some point, you will be tested, but I'm reluctant to say what is the next group, that will be tested. But utility workers were on a list that we created yesterday to determine, how do we, again, restart the economy.
All right, last one, and this is from our friends at the grounds who want to know, when it comes to the Gulf State Fair, are you a corn dog or a turkey leg kind of guy? one or the other. Well, being
turkey season, I wish I could tell you that I've had an opportunity to go turkey hunting and killed a turkey and I had a big old turkey leg to eat. But I'm going, since it is turkey season, I'm going to go for the turkey leg sort of guy.
All right.
Yeah. Thank you very much.
All right, thanks for joining us here on Fox 10 News. I'm Chelsea Sayasan. Now, we just heard from Mobile Mayor Sandy Stimpson. He says that the city is working on a plan to reopen the city. Now, part of that plan is more testing. He says who gets a test is a big question when it comes to opening dentist offices, beauty salons, and other businesses with close contact. Of course, he'll keep us updated on that. He also asks you for your patience when it comes to a successful reopening. Now, of course, you can find this press conference and more on our Fox 10 YouTube channel and Facebook page. We will break down all of these new details and the latest headlines on Fox 10 News at 4 p.m. I'm Chelsea Sayasan. We'll see you soon.